about subcutaneous injections. Now, the learning outcome of today's session is that students will be aware of the correct procedure for administration of subcutaneous injections. The learning objectives will be that you will have a working understanding of subcutaneous injections and demonstrate the 3 steps for administration. You need to set up the injection, select and prepare the injection site, and prepare and inject the dose. So, what is a subcutaneous injection? You're stop recording me. A subcutaneous injection is given into the fatty layer of the tissue just underneath the skin, seen here in this diagram. Don't put this on Facebook. Why are subcutaneous injections given? Subcutaneous tissue does not contain as many blood vessels as muscles, and therefore medications are absorbed more slowly than the intramuscular injections. Now, the preparation. The equipment you will need. You're going to need the patient's medication administration chart, the prescribed drug, syringe, cotton wool or gauze, or an alcohol wipe.
Right. I like the alcohol wipe.
Yeah. Now, do you remember last week's lecture we talked about the 5 rights of medication administration? So just to recap, you need to always be aware of the right drug, the right patient, the right dose, the right route, and the right time. Now, you want to check your medicine. You want to check the label and make sure you have the right medicine. You want to check the date on the vial because you don't want to use medication that's out of date. And if you're using a multi-dose vial or a vial that has powder you need to mix into the liquid, make sure you read the instructions to make sure you're doing it properly. If you will use the medication more than once, write down the date on the vial so you remember when you opened it. And always look at the medicine in the vial and check to make sure there's no pieces floating in the liquid or cloudiness, because you don't want that. Now, drawing up the medication. I'm going to give you a handout at the end of class for drawing up the medication, and next week in the next lecture we're going to do the practical, so I want you to have a look over that and we'll discuss it in more detail in the next class.
So miss, do I have to come back and clean your kitchen?
Yes. No talking. Questions at the end. Where can I give subcutaneous injection? Subcutaneous injections?
Yes.
No!
Okay.
No, that's
The belly.
intramuscular.
Oh, sorry. Oh, sorry.
Yeah,
In subcutaneous injections can be given in the arms, legs, or abdomen. Now, to locate the sites on the arms, you would fold the arm across the chest. It does look like Luke,
You
doesn't
should have
it?
put a picture of Luke up there.
I should get Luke to do it. Oh, you would fold the arm across the chest and place your hand on their shoulder and draw an imaginary line. You want to place your arm at their elbow and draw an imaginary line, and the space in between is where you can give the subcutaneous
But if it's an
injections.
imaginary line, we won't see it.
It's imaginary. And then you can do the same on the back of the arm. For the thighs, same again, you would sit down and place your hand above the knee.
Really? Come on. You're going over 10 minutes, right?
No, I'm not!
Come on.
Place your hand on the uppermost part of the thigh and draw an imaginary line, and between those two again would be the site for your injecting on the thighs. And to locate the site on the abdomen, you place your hands under the lower ribs, the imaginary line, and within an inch all around the navel, that is where you can give the subcutaneous injection into the abdomen. It's extremely important to rotate the sites to keep the skin healthy. Repeated injections into the same spot can cause scarring and hardening of the fatty tissue that will interfere with absorption of medication. Each injection should be given about an inch apart. So if you have to give 2 injections into the same site, you'd always make sure not to put them into the same hole.
Set it off.
Since the skin is the body's first defense against infection, it must be cleansed thoroughly before the needle is inserted. So what you do is you just rub it back and forth in the alcohol swab, and this would move the bacteria away from the injection site. But you always want to allow the alcohol to dry completely before administering the subcutaneous injection.
And not beer, Siobhan.
Because for
Any particular alcohol?
if you're giving a vaccine, the alcohol can activate it before it can be put in, and you don't want that. However, a study by Kawaja et al. 2013 stated that though the skin swabbing before injection significantly decreased the number of bacteria, there is no significant difference among clinical signs and adverse local or systemic effects with or without skin preparation with alcohol swabs before subcutaneous injections. Therefore, it can be left up to the preference of the patient or discretion of the nurse to use alcohol swab.
Bored.
So, the devices used for subcutaneous injection include syringes with a short 5/8 of an inch long needle. The width of the needle is usually 25 or 27 gauge, and there are many other options for doses that are more than 1 milliliter or for children. Now, during the injection, you want to take the cover off the needle, but be careful not to contaminate the needle, you don't want to touch it. And you hold the syringe in your hand like a pencil or a dart, and you grasp the skin between thumb and index finger, and you pinch it up. And quickly thrust the needle all the way into the skin. But you don't want to push down the needle while it's going in, and you don't want to push it in too slowly or thrust it in too hard. Now, you insert the needle at a 90-degree angle. This is important to ensure that the medications are injected into the fatty tissue. However, for small children and people who are very thin, they have very little subcutaneous fat. What?
Oh, carry on.
And therefore you put the needle at a 45-degree angle. But if you're using a pen, it'll be the 90-degree angle anyway. So after the needle is completely inserted in the skin, you release the skin, and then you press down on the plunger to release the medication into the subcutaneous layer. If you're using a pen, you want to press the injection button completely until it clicks. So what you do is you grasp it like this at a 90-degree angle, then you let go of the skin and press down the button and you hear it click,
Ouch!
and then you want to wait 10 seconds.
Did you just inject yourself?
This is a dummy needle for demonstration purposes.
That's Luke's dummy one.
But if
I need
it
more
was a real
alcohol.
needle, if it was a real needle, you'd hear it clicking.
Carry on,
So-
quickly.
Now, sharps disposal. When you're finished with the needle, you always want to place it into a sharps bin, and you never ever recap a needle. Keep the container out of reach of children and pets, and when the container is 3/4 full, take it to a healthcare facility for proper disposal.
No, we ring Dublin for that now, Robin. That's
Now,
wrong.
to make sure you're all paying attention, there's
That's
a quiz.
on, Robin.
There's a quiz.
Okay.
Why is the skin gently pinched up in a fold when giving a subcutaneous injection? Is it to elevate the subcutaneous tissue, for patient comfort, to improve peripheral circulation, or to prevent hematoma formation? Siobhan McNamara, what's the answer?
To prevent hematoma formation.
Wrong!
Can I-
improve peripheral
The
circulation?
answer is
Can I phone a friend?
elevate the subcutaneous tissue from the underlying muscle.
That
Can
was
I
it.
phone a friend?
Now, what is the rationale for giving medications through subcutaneous route is it there are many alternate sites for subcutaneous injection, absorption time of the medication is slower, there is less pain receptors in this area, or the medication can be injected while the client is in any position.
I'll take
Very-
50-50.
The rationale for giving medication through the
Why would you give it in a subcutaneous injection?
C.
No! Siobhan! A! No!
B.
The answer is B!
I got
Absorption time!
I was going to say B.